Let's get more on that wavering guidance from the CDC by talking to our David Agus, who joins us now. Dr. Agus, good morning to you. So the CDC was already saying that the virus spreads easily and rapidly between people, but it was focused on the droplets that hang in the air as opposed to these aerosols, which float, I guess, for hours. How big is that distinction?
Well, the droplets are within 6 feet. When you and I speak, droplets come out, and we know that is the dominant mode of transmission of the virus, period. That being said, aerosols, the virus can float in the air, linger longer and further. That may be a mode of transmission. It's not the dominant mode, but it may be a mode of transition. We just don't know. What you're seeing is the sausage being made for the first time in front of the American public, right? We are learning the science as we go, and this is new. We normally know the science because viruses have been around for a long time, as other diseases. But here we're learning as we go.
Do you think the CDC, given the challenges it's had recently with maintaining public trust, should have just kept the guidance up? We heard Dr. Osterholm from the University of Minnesota say, actually, this is good science. It was fine. Why not publish it?
What's interesting is that science going up on a website and then literally a day or two later, somebody finding that and putting that into the media, I do think is the wrong way to go. I think that there needs to be a conversation whenever there's a change, explain it in detail, because there are a lot of policy implications for changing that guidance. And so I think that we deserve a conversation. We deserve an explanation of what are the data and why, not just a change on a website.
So how would our lives change if this guidance became the new rule at the CDC, that this was a virus spreading through aerosolized particles?
Well, it would change how we isolate patients in a hospital, for example, and they would need specialized rooms that have specialized ventilation, which we don't have that many of them in the country. It would change some of the requirements for opening schools, restaurants, indoor places, to require certain ventilation requirements that are now not always there in many of these establishments. So this is a big policy change if it goes through. I think discussion needs to happen.
All right. But for the moment, we're thinking droplets and we're thinking 6 feet, no more, and we await further word from the CDC. And Dr. David Agus, thank you very much.
Well, and we're thinking masks. Remember,
and we're thinking masks, of course. Yes, masks and social distance.
And they block aerosols. They block everything.
Goes without saying. All right. Thank you very much, Dr. Agus.